All right, here we go again. I am attempting to do this DM intro video now, again, for the 700th millionth time. And I accidentally deleted everything on my phone. And I mean permanently, no, it's not in any clouds or anything, so it's just gone for at least like the last year. Anyway, I'm still getting ready for my doctor's appointment. It's been a minute. But I believe I'm going to start and I guess describe how, or tell how I found out I have thymic carcinoma, which is the cancer I am currently, well, not currently, but that I have, I'm dying from, that is eating my body alive. So, I was working for a tree company about a year and a half ago, doing tree work, obviously, and I started getting these really bad pains in my neck and in my face. And I thought maybe I'd gotten hurt at work because, unfortunately I get hit in the head a lot at work. It's kind of part of the industry, I guess, some more than others. I got hit a lot more probably. Anyway, so I thought maybe I got hurt, right? And I, being not so much stubborn, people are going to call me stubborn because I didn't go to the doctor right away. I didn't have insurance, okay, and it's expensive. And I'm obviously I'm on low income. I have been most of my life, and I couldn't afford to go, so I didn't go. I tried to suck it up and see if it would go away. If it was an injury, usually they do. But that didn't happen. What happened is it kept getting worse and worse. So I still didn't go in. But one day I wake up and I couldn't breathe and ran to the kitchen because it's the closest place to my bedroom. And I'm trying. And I start vomiting a little bit. It's acid more than anything, and which was really strange. It's never happened to me before, so I'm thinking make acid reflux, right? Well, calling my boyfriend. I couldn't talk either. I couldn't breathe. I sounded like Minnie Mouse. I had no voice. I called him in, like something's wrong. We couldn't. I guess there was really nothing to figure out, but I was concerned. So, I go to work. And I'm thinking laryngitis. I was thinking that for weeks. Sometimes that happens in the winter with me, especially because the job I have, I overuse my voice sometimes. And being a vocalist or a singer, sometimes I overuse my voice or use my vocal cords improperly. And I'll lose my voice a little bit. But it never lasts that long. This lasted a lot longer than it should have. And on top of that, the pain kept going. It kept getting worse and worse. And it wasn't just sharp stabbing pains. Now it was like electricity shooting through my face and my neck. And I'm like, oh my God, there's something. This is awful. I don't know what it is. So one day in particular, I can't breathe. It was getting really bad, and I started panicking a little bit and called my best friend, and I says, what do I do? What should I do? And she agreed and talked me into going to the ER. So I went into the ER at one hospital, and it was going to take 4 hours to get in. They say, well, I didn't think I was going to be able to wait 4 hours because I couldn't breathe, and the pain was really bad. So we went to a different hospital, and they get me in quick, like real quick. And they get me back, and I tell them, hey, I can't breathe. I haven't been able to breathe properly in a while, but it's different now because it feels like I'm being strangled. There's a lot of pressure in my neck. It wasn't, my lungs were inflating and deflating fine. It wasn't that. I felt like I was being choked up. So the doctors come in, and she's listening to me, and she does, this, that, or the other, and she does what, they always do in the ER. They don't listen to me And when I'm telling them, all they hear is, can't breathe, blah, blah, blah. So they're like, oh, okay, well, we're going to go ahead and order a chest x-ray, which makes sense, right? Because lungs, breathing, except for I had described to them that it wasn't a lung issue. I knew I could feel my lungs working. It was somewhere in here. There was a lot of pain, a lot of pressure. Something was wrong. So they ordered the chest x-ray, nothing up here. And that comes back and it's clear. Lo and behold, there's nothing there. I didn't think there would be, because that wasn't the problem, right? So she tells me, the lady, that I have allergies. Oh, shoot. I have allergies too, because I live on the river. I go, no, ma'am, I don't have allergies. I've never had seasonal allergies in my life. I never have even really been sick. She says, well, we're in Missouri. We're right between 3 major riverways. You definitely have allergies. We all do. And I'm like, I grew up on this river, lady. I don't have allergies. I know what allergies are, and I know what I don't have. I know my body. Well, she, looking at my chart, I'm sure helped her make her decision, because I am and have been in the past a psych patient. I just been released about, I guess it'd been about 8 months earlier. I'd been released from the psych ward for a mental break that I had involving one of my mental conditions. Anyway, I had a break and I was let out. So that's same hospital, company, whatever, SSM. And I know they saw that in there. And so she tells me, well, we think, they do their exam. There's nothing there. They don't feel anything. There's nothing. They look down my throat. There's nothing, like with their little, whatever. They look down like, their little tongue depressor, and nothing down there, right? No, I know that. And they say, well, we think you just have allergies. So here's a Zyrtec, and you're probably having a panic attack or a little bit of anxiety is what it seems like is why you can't breathe. So here's the Xanax. And they send me on my way. It was devastating. It was at the time even. I remember being upset because I know what a panic attack is. I've had many of them. I know what it feels like. And that is not what was happening to me. But, the doctors know, don't they? They know better, more than I do. Supposedly. So, I'm home. I go home with my Zyrtec. Oh, I don't like that at all. And, I continue to live, or try to live normally. As I would any other, like I could with this pain. I'm taking a leave every day at this point to try to counteract them. It just wasn't working, and it was getting worse. So I think, I don't know exact timeline, but maybe a week or two after that, maybe a little more, maybe a little less. I can't remember. My brain doesn't work quite as well as it used to. I'm at work, and what the heck am I doing with my eyebrows? Ooh, and that day in particular, it's a bad day. I'm in a lot of pain, and I'm on a job site. We're short-staffed, as does tend to happen, and I'm crying, and it won't stop. I mean, it feels like electricity and fire just shooting down my face, down my neck, down my arms, and I start vomiting. Okay, so now not only am I on the job site, on the ground, and we're in a very public area, doing what we call city trees, and here I'm crying, vomiting on the ground, and so I'm refusing going by ambulance, telling them, do not call 911. So the owner comes, and he's like, okay, we need to get you to the ER then, at least. You got to go. I'll drive you. And I was like, okay, that's fine. Let's go. So he gets me there, and I go into the ER, and it's still not getting better. And they get me in. They get me in at this point, right? I'm just, okay. So I do feel like I went out a little bit out of order. I'm going to stop that part of the story and put it on the back burner for now. So just remember, I'm in the ER. Not doing well. Before that, what had happened in between, I think, if I remember correctly. Yeah, is in between me going because I couldn't breathe to the hospital that said I had allergies and an anxiety attack. I ended up getting a kidney infection. And so I went to my regular doctor, who is a nurse practitioner. And while I was in there, I told her at that point, like, something's going on, okay? We need to talk about, I have pain and won't go away. And the funny part is that I didn't even think about it until the end of the visit. And I was like, oh, yeah, by the way, this is happening here, and, blah, blah, blah. And she it took her less than 2 minutes. She feels it, listens to me, weight loss, breathing issues, voice gone. And she goes, I'm going to order some thyroid function testing. So we get that done. Luckily, they do that blood work in the office, because otherwise I probably would have waited too long for that as well. But we get that done, and that comes back, thyroid's fine. She's like, well, something's, it's okay. We're going to get imaging done, an ultrasound, because it's the cheapest. You need to find somewhere that'll do that for you, because they won't do that anywhere here, like at a hospital, or most normal, non-specialty doctors don't just have an ultrasound laying around. So she gives me the script for one to order. And I finally found Metro Imaging that does, they'll do private pay or self-pay, pardon me, imaging, but I don't have the money. It's like $300 and something. So I started GoFundMe at this point, because I'm like, okay, something's wrong, and I need to get this. There's probably going to be more testing. I don't know what's going, and we don't know what's going on yet. So I have to borrow money to get this done, and I get it done. Okay. So I get it done, and I schedule an appointment with an ENT. We get the results. I'm like, okay, I'm reading the results, and I'm like, okay, well, there's something there, right? I don't know what it is yet. All I can really determine from the order, or the description that the imaging gives, is that there's a mass. Okay, I'm like, okay, there's a mass in there, and that it's a hard mass, and blah blah blah. So I go to an ENT. He looks at it and he's like, this doesn't look good. It kind of looks like, I don't want to say the C word, but it kind of looks like something associated with the C word. We all know what that is, cancer, right? So he's like, we need a biopsy. We're going to have to do that in order to just know, because there's no other way to determine what this thing is without it. Great. No insurance. Here I go. And I'm like, now I got to figure out how to pay for a biopsy. Luckily, this guy, and he's a really cool doctor, really. He was very understanding, very concerned. And his concern made me concerned. Because I'm not, I've never been really sick, like I said. So I'm like, oh my God, if the doctor's concerned, he does this every day. So we set up a time where he's going to do the biopsy. And he's like, we'll figure it out. We'll bill you. Do not worry about bills. This is not a time. You can't do like you've been doing and just wait. You don't need to worry about bills right now. You just let them rack up. Figure it out at the end of this. So we get the date. And the hospital calls and says, oh, your imaging, you didn't get it done here. We can't take it. It's not good enough for us. We don't. Okay, great. Awesome. So you want me to go rack up thousands of dollars in the hospital so you could have the same exact picture that I just gave you on an imaging disc? No, not doing it. It was a whole thing. Okay. So at this point, it's about that next week. Is where we're going to take that story from the side burner and slide it back over to the main burner. Because now I'm in the hospital in the ER. I'm in pain. It's a lot. Too much. I'm vomiting, right? Yay. And now the hospital gets what they want, right? They get their imaging. Because I had described, I told them while I was in there, I'm like, okay, so this is what's happening. And it's associated with this and that and the other. And I do have a biopsy scheduled. Blah, 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 blah. And so they are like, okay, we're just admitting you to the hospital. Bow. We gotta manage your pain anyway, because you obviously cannot function with this. So, now I'm admitted into the hospital. Okay. And I'm there for a couple days while they're trying to figure out, I guess I wasn't describing nerve pain properly. I don't know, because I've never had it. But I told them, this feels like I'm being electrocuted and that my face is and my neck is on fire. It hurts so bad and I'm crying. Well, it took a while. And they kept giving me all these pain blockers, like regular stuff, morphine, things like that, which I hate. I can't tolerate them. They make me sick. And finally, an oncologist comes in because, like I said, the ENT tells the oncologist, they talk, and he's like, look, I got to do the biopsy, but, you need to kind of look at the imaging. And they're like, yeah, it doesn't look good, but we need to confirm. Once in Missouri, once you get medical oncology involved, and you have no insurance, and you have low income like I did, you're automatically approved for Medicaid. I guess it's a good thing that the city, or not the city, but the state agrees that, if it's something that could be potentially life-threatening, they have to, they're going to give you your coverage because otherwise you'll die. So at this point, the hospital's like, okay, we already know you're going to have insurance. Not a big deal. We're going to go ahead and just move forward with everything. Just, here we go. So, and away we go. And I'm off to the races. God, this all happened so fast, too. It was very mind-boggling. And I'm getting my biopsy done. It's an FNA biopsy, fine needle aspiration, I believe it's called, where they stick a big old long needle in there and they just kind of grab chunks, small chunks, albeit chunks, out of the mass that they're biopsying. Okay, so we get, that's done. I've been in the hospital for about a week now, and I'm over it. So over it. I want to go home. So I get to go home because I left. I ran. They had my pain management down. They were just taking their time with discharge. And by now, it's almost evening. I know the doctors aren't coming back. I'm going to be dealing with all the nursing staff again overnight, and I'm not ready. I miss my kids. I miss my house. I miss my boyfriend. I miss my life. So I'm out. I take out. And the next day, I get a call. They have the results back. Okay, so I had already known, though, because I read the report when it came in. And I do know enough medical science that, I knew what I was reading. And it came back positive for malignant cells identified as squamous cell carcinoma. I'm like, okay. So first thing that hits me is, oh, God, malignant, great, cancer. That's cancer. And it's carcinoma, which the ENT told me, that's what we don't want it to be, because they're a lot harder to get rid of than, I guess they were hoping it was lymph node or either the lymph nodes or the I can't remember what the other one was right now. But anyway, he's like, please don't let it be this, and it was that. It was carcinoma. So I'm like, oh, God. Okay, at that point, I guess I was shocked or dazed. I don't remember a whole lot about how I reacted to reading the news or hearing it. I do know I called my kids and my boyfriend and I said, okay, this is what it is. This is what's happening. Let's not overreact because we don't know exactly what we're dealing with yet. But I'm pretty sure I probably maybe I didn't overreact. I'm pretty sure I reacted to how anybody would have reacted. I do remember crying. I remember I ran outside to the river, which, let me see if I could show you. It's a dirty window, don't judge me. Ran out to the edge of the river in my backyard, and I cried, and I cried. And I called a couple of people. I do remember doing that. To tell them, because I didn't know what to do. I don't know why I thought that would help, but I do remember calling my boss and telling him I'm not coming back in because I needed time to process it, and I didn't process. I still didn't do that at the time. I thought I was processing it, but I know now that I wasn't. I was kind of on autopilot because after that, everything that came after that. I didn't really react to, I feel, appropriately or much at all. Okay, so, and I'll kind of describe that a little more maybe in a later video. But, okay, so that's that, right? Now we know I have squamous cell carcinoma, and it was confusing. The ENT, I go and I talk to him, and he's like, yeah, I'm not happy with that answer. Squamous cells, usually it's associated with skin cancer. So everybody I told that to, they're like, no. They're like, how do you have that? Yeah, it's if it's inside. And I'm like, I don't know. I don't know. Don't know. Well, that's what the doctors were like too. They're like, it doesn't make sense. We want to do another biopsy. This time, we want to do it with you in surgery. We want to put you under. This is the first time you're awake for an FNA. They numb the area, but you're awake for it. They sedate you, whatever. I felt the whole damn thing, all of it, every bit of it. I always do. They never hear me when I tell them this, but always do. So, yeah. So here we are. Okay, now we have to schedule a surgical biopsy. Okay, so we do. And I've already met with oncology at this point. They're like, okay, well, for now, I guess we're going to classify it as head and neck cancer. You have head and neck cancer, but we don't know the origin. So it's head and neck cancer with an unknown origin, which kind of gives them wiggle room, I guess. It helps them get a guideline and a treatment plan, so they can kind of start building something to try to, so we can start. We don't want to wait any longer. It's already been too long. I already waited too long to get in and to even have this thing looked at. So, yeah, so we get that. We do that biopsy. It's surgical. Get it done. And, I need a different mirror. And that comes back as the same damn thing. Squamous cell carcinoma. Well, what the hell, right? They're like, okay, well, I guess that's what it is. Weird, because we can't find the origin. And they do other tests, and they're just like, nothing's coming back right. That makes sense. So I guess at some point, they had already sent off the FNA biopsy, the first one, to have genetic testing done. And which is awesome. I'm so glad we can do that. And I'm so glad they did that, because it's the only reason we found out with pretty, definite probability that it's thymic carcinoma. They said if this comes back any more than, I believe, 15% toward one area, that's what we go with, because it's kind of all we've got to go on. Well, this came back 75-ish% being thymic. I think it was something like 16% lung or 14, somewhere around there, and then all those little numbers that tie everything else. It was like liver. Pardon me. So, thymic carcinoma. Okay, well, that's pretty rare. It's not, unicorn rare, but it is unicorn rare. It's actually called a unicorn. It's even our logo is the fighting unicorns. It's not like the rarest of the rare, but about 400 cases a year, which makes it still pretty damn rare. And there's not a whole lot of research on it because of that. So they're like, well, all right. And again, I jumped ahead a little bit. So let me pause that again, slide it back over here. And while we were waiting for the genetic testing to come back, which took a long time, it took about a month. So now we're in May. We're at the end of May. And they're like, we got to go. We got to do something. We're going to treat it head and neck, unknown origin, and go. That means radiation first. And we're going to shrink it down, and then we're going to have surgery. We're going to remove it and clean up with chemo, cut and dry. But it's going to be great. My amazing radiologist, he says, I've seen this is just, it's going to melt. I know it. It's going to be great. So we do radiation. We're set up for 35. I believe that's one every day of the week, 5 days a week for 35 weeks. Well, no, not 35 weeks. I'm sorry, 35 sessions. God, that would have been forever. It didn't math out on that. So anyway, we get to 4, and I remember being so scared of, it was just radiation. They make this mold of your face, and it straps you down to the table, and you can't move, and you don't feel anything. But I couldn't breathe as it is, and this thing was constricting, and just the thought of radiation, being pumped into my body, really, I didn't like the thought of that. It was scary. But, I get to sedated. I had to have some Xanax for that first 4. I did 4. They get the origin in. We know it's thymic carcinoma. They said, stop it, Rick. Stop. We can't do it that way. We gotta start with the chemo now. We gotta do chemo, and then we've got to do radiation if we can, and then we do surgery if it's possible. But something didn't seem right. Let's see, the way that came across, because it was very urgent that we stop now. I mean, I got a call. They're like, well, you cannot come in today for this radiation. You have to come in for consult first. And I go, shit, okay. Well, now, again, it was never really stated, and nobody said, oops, we screwed up, but you could tell by the way they were handling it, by the way it's talked about still. Because I think what happens is radiation causes the tissue around it, whatever it's being treated, on top of what it is treating, to harden. And I have a sneaky suspicion that may have played a factor in why I wasn't able to get the surgery done either. But I jumped ahead of that too, so spoiler alert there, surgery didn't get done, I guess we know, right? And this is my scar, by the way. That's my surgery scar. I don't even know if you could see it really well. Right there. That was from the biopsy, though, not because I didn't have a removal done. So. Now we're doing chemo, right? Oh, I need to tell myself this is going to be, it's rough. This is going to be rough. This is a really strong chemotherapy drug. You're going to be sick. You're going to be, your hair's going to fall out. It's going to be awful. It's going to be awful. But if it works, if it works, it's all that matters, right? So that's what we go with. And I start chemo. And I guess that's a good spot to stop for now. I guess that is the beginning of the entire fiasco. I can obviously, I will answer questions if I left something out you wanted to know, or maybe, I don't know, just if there's something I, didn't touch on yet, but I'm not going to divulge till later. I won't answer it, but let me know in the comments, and I'll try to get it done for you. Thank you.